Guys, welcome to this session. This is our revision series on Oracle, and I'm Dr. Ankit, and I'm your faculty of anatomy subject over here. This is going to be for the university exams, so quick revision series. And here we'll be dealing with our topic today. And the topic today that we have decided is the topic that is a general anatomy over here, right? Just a second. Right, 1 second. And here we go. Okay, great. So guys, yes, the topic that we are going to discuss today is the topic of general anatomy. It's going to be a 1 hour class. And we had divided this whole anatomy session for our first internals into 10 different sessions. Okay, 10 different sessions will be there. Today being the first one. Then we are planning to cover up the embryology, the upper limb, the thorax, and a bit of genetics as well. So these sessions are going to be beneficial for university exams, and also if you hear all, then there will be some tips for the next exam or the NEET PG exams as well. So now, guys, these are the questions which can be asked in your exams, which can come or which normally do come from the topic of general anatomy. They can divide into the long essay questions, the short essay questions, the short answers, and we will be discussing them in a bit. But along with them, a bonus point over here is that we'll be discussing some of the MCQs as well. Okay, so that we have a good idea of what all the MCQs can come from this topic, because nowadays MCQs are a normal part of any examination. Okay, so let's see what are the different topics that we are going to touch. So, for example, long essay questions can come from general anatomy, like discuss the anatomical terminology used to describe the positions, directions, and planes of the body. These are the first things that we normally deal with when we start with the general anatomy, that how to give terminology. That can come as a question. Other questions can come from the types of joints, which are one of the most high-yielding points or high-yielding topics from the general anatomy. Then another anatomical planes can become as a short question. Then you have the skeletal system, bones, and all. They can come as a question as well. Regarding the short questions or short answer questions, synovial fluid can come as a small question. Question can come from the synovial joints likewise. So we'll be touching on most of these topics, plus we'll discuss now some of the MCQs as well. Okay, let's quickly see the benefits of Auricle over here. So here we have recorded classes, live classes, exam module, hard copy, book set, and practical sessions, and all these. Very, very important and very, very helpful as well. As we'll see in these particular slides, all the pointers, all the benefits of all these different, we can say the sub parts of the platform is shown over here. Like we have the hard copy notes, we have the Q bank, you have the practical sessions, and these are the different plans over here. We'll discuss them in the later part, and you can use even the code over here to get some discounts. Let's come to the topic, and let's discuss about a bit of theory exams. So today being the first session, we'll be also dealing with a couple of things, like what are the things that we can do, or which can help for our writing the exam questions over here. Just a second. 1 second. So guys, going for the exam, and there are obviously many things that come to our mind, that how we are going to perform over here, and what how are there any tips which we can see or we can benefit while writing the exams. For that, just a second, let me open this and annotate right over here. Okay, perfect. Okay, so yeah, a bit of initial tips or general tips that is going to be very helpful. So some tips I want to begin with, tips for writing the exam, particularly the anatomy over here. Suppose you are giving a theory exam and there is a set of question paper. Some of the tips which I normally keep on repeating every year to the students is, for example, the first tip over here would be, you should be very clear with the time management. Just listen for me for 5 minutes over here, and I'm sure you will agree with me with most of the points. If you are not aware, then please note them. First point is time management. You should be clear, okay, that this exam is of dash number of marks, 100 or 80, whatever it is, and we have dash number of minutes. Okay, simple as that. So your time management should be clear, and always try to attempt all the questions, because therefore then only the time management can come into play now. So always try to attempt all the questions, whatever has been asked, attempt all the questions. So this is very important in the beginning. The first point that I can tell you guys over here is the time management, because if you are left with 1/3 of the time and half of the question paper, then obviously any normal person would panic. Number one thing is time management. Second number is practical tip over here, because I've been checking paper from so many number of years. Normally, students they give random answers, right? So start with answer 4, then answer 3, then answer 7, something like that. Try to be in order. Sequence is important. Try to be in sequence. I'm saying try to be. Suppose the first question comes and you have no idea of the first question, then obviously you can go with the second question. But at least try to be in sequence. And this will help, because sometimes what happens is, though it happens rarely, but sometimes what happens is any question can go unchecked because it merges. There is so much of this overlapping of the topics that it can go unchecked. Therefore, for that mistake, because it's you who is going to suffer for that, I would always advise that whenever you're answering any question, say answer question number 1 part A, we start with the answer over here, fine. Always try to write the question above the answer. Or if you think that, okay, it's going to waste the time, it's not important, it's not mandatory, right? It is not mandatory. At least write question 1A, and then at least leave a couple of lines over here, then start your answer. So in the end, if you have like 5 minutes, then you can at least write the questions. It is always beneficial. Okay. Try to keep that in mind. Try to be in sequence, and then if possible, okay, try to write the question as well. If not in the beginning, then at least leave a couple of lines. You can write down the question at the end of the paper when you have extra time, and when you have the time and you have finished all the answers. Third point over here, which I wanted to tell you guys, is that in case of anatomy over here, the first impression always is very important. So if you have read the question paper and there is a question that you are very good in this knowledge and all of that particular topic, then try to answer that first. Okay, it can be the first question. If that is very good, fine. Or if it is second or third, okay. For the beginning, it is good. So try to answer your best question being first, or first over here. So this statement will be contradictory to my second statement, but over here, therefore I said try to write in sequence. If not, at least for your first question should be your best over here. Okay. These are the things which are obviously important. Then okay, fine. You have time managed and you have trying to write this question. Then neat and tidy is very important, guys. Neat and tidy. If your writing is not very good, at least write it separately so that it is easily readable. Okay, examiner can only give you marks if he is able to read your answers. That's common sense, right? So try to make your paper neat and tidy. And finally, obviously, people keep on telling you, anatomy being a subject, diagrams. Diagrams are a must. Diagrams are a must over here. I'm not saying try to make diagrams, I'm saying must over here. Okay, because anatomy is we are reading the understanding the whole body. Whatever topic is being asked, try to make at least 1 or 2 diagrams, depending on if it is a 10-15 number question. Obviously, you have to make 4-5 diagrams. At least if it is even 1 or 2 question, 1 or 2 number question, at least 1 diagram should be there. Unless and until they are only asking, okay, enumerate this, enumerate the branches of dash dash artery, 2 mark question or 1 mark question. Then diagram is not important over there. But in other questions, diagram is a must. Okay. Another point over here, just for the last points, is flowcharts. Okay, you can make some flowcharts to make your topic or to make it more presentable. Okay, flowcharts, you can go with boxes. You can write some important boxes, only important points over here. Okay, flowchart box very important. Then last point over here, I'm coming to the last point over here. Suppose there's a question of 5 marks or 7 marks. The question is of say for example, write about the brachial plexus, our upper limb and nerve plexus over here. For a question like this, try to make subtopics of your answer. Okay, for example, as I said, brachial plexus, you can make, okay, how it is, origin, okay, and what are the root values of it, what are the branches of it, or what is the clinical applied of it, and there can be 4 5 subtopics for any topic, right? So subtopics, and then you can answer that. Just by looking at the subtopics, examiner knows, okay, you know the topic. Okay? So reviewing what I said, okay, time management is a must, without doubt. Time management is a must over here. Without time management, you don't want to panic in the last half an hour, because that will destroy your whole months of your practice. Time management is a must. You should note down, okay, the half time is over. My 55 to 60% paper should be completed. For example, there's 2 hour paper and 100 marks. Just for example, 2 hour paper and 100 marks. By the end of 1 hour, your 55 to 60 marks paper should be done, so that you don't panic in the last and you have some time to revise. That is very important. Try to write in sequence. If possible, write even the question also, or at least suppose, as I'm saying, the brachial plexus, say question 3b, brachial plexus, at least write brachial plexus, then start with the answer. Best question should be your first, because that creates a very good impression. The teacher knows, okay, that this student has at least studied some points. He knows the subject, he has given some hard work, because teachers, examiners like the students who are doing hard work, because obviously hard work is needed. Neat and tidy, at least. I'm not saying it should be very beautiful, but neat and tidy. You can use multiple pens depending on your choice, but at least 2 pens, 2 color pens should be there. I'm saying multicolor pen, or 2 color pens at least minimum should be there. One for the heading, one for the writing. So black and blue would do. That's a basic minimum. You can go with, for diagrams, obviously you need a red for artery, yellow for nerve, green for tendons, brown for muscles. That is different. Diagrams are a must for anatomy. Flowchart and boxes, suppose you know about a topic very nicely and there's some very important point over there, or some important clinical applied, make a box. Try to make a box if possible. Flowcharts to describe any topic. So for example, there's a muscle like a deltoid muscle, right? You can just write deltoid, okay, you can make a flow chart, okay, origin, insertion, this is the action, this is the nerve supply, blah blah blah. So any topic like that. So that flowchart, it will be the same information which you will write in theory, but that flowchart will be more appealing, will be looking more better, and it is sorted. The answers look sorted out. And finally, as I said, that if there's a bigger topic, bigger question, then you can write in subtopics. Guys, this is something which I wanted to just share with you guys, because this is where people normally after first exam, when they don't get good marks, then they start to panic over here. Okay, so these are the points. Keep them in mind. Let's move to the topic of general anatomy. And general anatomy, what are the different topics that we are going to see is, first of all, general anatomy. Let me just write down what are the different things that we are going to touch upon. And between that, I will telling you all the important one-liners, all the important, even the MCQs also we're going to discuss, and the important points which examiner needs to see and hear when you give a vibe also. So general anatomy, obviously start with the anatomical positions. That is a must. Anatomical position should be very clear. Anatomical planes should be very clear. This is basic of the entire MBBS, not just anatomy. Basic of the entire MBBS, entire medical life. This is a basic. Okay. Then we will obviously go with the bit of bones and classification. Then the most important topic over here, the joints, very frequently asked. Even in your PG exams, the MCQs come a lot from this topic of joints. Okay, these are the basics. Then obviously there will be other things like skin, fascia, all of that. So we'll be touching on all of this, including the MCQs. Okay, I hope the point is clear. And I will start with the MCQ. Let's start with the MCQ and let us see how we proceed further. Let me just start with an MCQ over here. Just a second. Right over here. Okay, here we go. Okay, so here's the question. I will read out the question for you guys. Which of the following pair is correct regarding the type of section and the divisions resulted? Okay, let's see the options over here. Just a second. Right. So these are 3-4 options over here. Type of section and the division resulted. So sagittal section, does it divide the body into anterior, posterior? Sagittal section, does it divide the body into superior, inferior, coronal, superior, inferior, or horizontal, superior, inferior? These are the type of questions that can come. Over here, the answer is what? Answer is our option number D, the fourth option over here. That is horizontal divides the body into superior and inferior. because you do horizontal section. We'll do that in theory. I'm just priming you, giving you some MCQs over here so that your mind is primed on what we are going to deal in the next couple of minutes. So side to section is like this, divides the body into right and left. Coronal is like this, divides the body into anterior, posterior, and horizontal or transverse is like this. It divides the body into superior and inferior. Okay, let's see another question over here. A patient had a left, listen carefully, had a left infraumbilical. Infraumbilical means below the umbilicus. Paramedian incision, not exactly in the midline, but slightly parallel to midline. So patient had a left infraumbilical paramedian incision through the anterior abdominal wall. Where exactly was this incision made? Okay, I got the point. They are basically asking the meaning of left infraumbilical paramedian incision. Okay, let's see the options over here. In the midline below the umbilicus, in the midline above the umbilicus, to the left of the midline above the umbilicus, to the left of the midline below the umbilicus. I hope not very difficult. Left side, fine. So A and B we can rule out. It is saying midline, it is not median, it is paramedian. So it is either C or D. Infraumbilical, it is below the umbilical. So C says above the umbilicus. C option says to the left of midline, above the umbilicus. Above is not possible. The answer is option number D. That to the left of the midline, below the umbilicus. So it is left infraumbilical paramedian incision. Right? Let's see one more regarding bones. Let us see one question from the bones. Then we'll come to the topic. For example, here's a question on the bone. That which of the following choices is an example of a flat bone? Okay, flat bone. Options could be like humerus, sternum, hamate, and maxilla. Humerus is the bone of the arm. We all know upper limb. Sternum is in the midline anteriorly. Hamate, where is hamate? Hamate is a bone of the carpal. And maxilla is a facial, one of the facial bones where the upper jaw teeth are lodged. So flat bone, even if you have apply some common sense over here, answer will be sternum. Sternum, if you have seen it and felt it in thorax, you know it's a flat bone. Okay, so MC questions can come like this. Let us come to the topic now and discuss some of the topics over here. Just a second, and here we go. Right. So here's what we begin with the anatomical positions over here. Okay, anatomical positions over here. So just look at the image over here and try to understand what is anatomical position. Anatomical position is to help you to name the entire body. That's simple as that. Palms should be faced forward like you have seen the left palm. Feet or the foot should be near to each other. Both the leg or both the foot should be near to each other. Patient should be looking straight with arms by the side and palm facing forward. As simple as that. Whatever you're seeing in front, this all comes under the anterior part or the ventral part. Okay, I hope we all know about it. This can come as a Viva question also. What is behind is the posterior or the dorsal aspect. Okay, why is this needed? Because we need to name the things. Body is so much of things are over here. You need to nomenclature them. Let's move ahead. Planes over here, as we did a question also. It's a sagittal image, sagittal plane image. You're seeing that the plane is going like this, and it is dividing the body into which two parts? Right and left part. Simple as that. If it is a median sagittal, understand, if it is a median sagittal, it is right through the midline. And if it is a paramedian, or we can also call it as parasagittal, then it is parallel to the middle like this. All these sections are sagittal sections. This is mid sagittal or median plane. These are parasagittal. Let's see another one. Coronal. Coronal is plane going like this. Okay, and it divides the body into anterior and posterior parts. Anterior and posterior parts. Okay, now you might ask, why do we need to know all this? Because guys, nowadays CT scan images will be in there in front of you. You should know which section has been taken. And then you have the transverse or horizontal section. It divides the body, as there was a question, into superior and inferior part. Simple. Let's move ahead from here. This is again an image showing you all the three fundamental planes. This is very basic, but for the first day it is very important. But as students reach final year and all, this basic can be a bit hazy and might confuse in the exam. So remember that. So fundamental planes over here. What is median sagittal plane? Through center, parasagittal is parallel to it. So this is a parasagittal section over here. That's a median section. This is a coronal dividing the body into anterior and posterior parts, and likewise. Okay, let's see some movements now. Name should be clear. Now, One more thing I need to add over here, whatever diagrams you see in whatever notes or textbooks you read, you don't need to copy the entire diagram. You need to make a diagram at least so that it is understandable and it should be labeled well. That is what the examiners are looking for. Okay. So don't worry, okay, I have to make such and such diagram, hand should be like this, no problem. It can go a bit here and there, but labeling should be there. So movements over here, flexion, extension. Okay, flexion is when the angle is decreased, extension when it is increased. The knee joint, it is on the posterior aspect. Then flexion, extension of the shoulder, simple. Some movements over here. Even they can be asked in your vivas also, not just the theory exam, even the viva. Then if you go to the entire upper limb, abduction going away from the mid plane, adduction means coming towards. So adduction, abduction should be very clear, should be very clear. Same for the fingers, adduction of fingers, fingers coming close to each other, adduction, away, abduction. Now here they may also ask you that in case of hand or the palm, what would be the axis? Axis, you remember, it is this dotted line over here. So it is passing through which finger? It is passing through second or third finger. Now suppose these are ways to confuse. Suppose there's a viva going on and we ask, okay, in palm where does the axis pass? And the student says, sir, it passes through the middle of the middle finger. Very correct. Then we might ask, it is second finger or third finger? Second or third. Okay. So always remember the counting starts on the thumb. Same goes for the toes of the foot also. This is the first finger is the thumb, second finger is the index, third finger is the middle finger, fourth is the ring finger, and fifth is the little finger. So answer will be our third finger over here. See, simple. Other movements, medial rotation and lateral rotation. Okay. So you should know these movements. I mean, it should be crystal clear. Medial rotation, when we say, then obviously you can see from the image that it is movement at which a joint. Here we are looking at a movement at the shoulder joint, because in this movement, this is the area where the bones are actually moving. Okay. So medial rotation, when the anterior surface of the arm faces medially. Lateral rotation is when the anterior surface of the arm faces laterally, rotates laterally. That is lateral rotation. Supination, pronation. Always do remember, we have been taught from our MBBS first aid days that beggars supinate. Okay, beggars, they supinate like this. This movement is supination. And opposite of it, this is pronation. And we also used to learn like priests, they pronate. When the priest is giving blessings, then the hand goes like this over the head. Priest will pronate and beggars will supinate. If they ask you, okay, tell me, in the anatomical position of a human body, the forearm is placed in a supination or a pronation position. That can be a question. What would be the answer? In an anatomical position, what would be the position of the forearm? Supination or pronation? Answer will be supination. Yes or no? Supination. Palms facing forward. That is supination over here. This is supination. Okay. Circumduction is combination of all the movements. Like when you do a balling or when you just rotate your entire shoulder joint. The shoulder joint is a ball and socket joint that we'll see. This is circumduction. Okay. Inversion, that comes in the foot part, but understand that inversion means that the sole is facing on the inner side or the medial side. This is inversion of foot. Okay, the lower limb we are not said, but at least in general anatomy you should know this, that this is inversion when the sole faces medially. The sole faces where? Sole faces medially. Eversion is when the sole is facing laterally or outside. That is eversion. This opposite. Basic movements. Then again, movements of thumb, very important. Flexion of thumb. Then extension of thumb, adduction, abduction. If you go through our previous lectures, you will see that we have done this, and opposition of thumb. I will just demonstrate these movements of thumb. This is flexion, extension. This is adduction. Then what is abduction? Abduction is if you place your palm like this and your thumb is pointing to the roof. This is abduction, abduction of thumb. And opposition is touching the pulp of other fingers. This is opposition of thumb. So remember this. Okay, now these are all the basic movements. Then image of the skin. Yeah, skin, some layers are over here. Don't worry. They might ask you, but it is one of the rarely asked questions in your theory exam. But you should know that there's epidermis, there's a dermis, and below dermis, what is there? There's subcutaneous tissue known as superficial fascia, and there's a deep fascia and muscle. At least the sequence should be clear to you. They can even ask you, it can come as a MCQ also. What? Like what? Like there's an incision. I don't know whether it was an MCQ. We'll just see. Incision given in the abdominal wall or anywhere in the body. what are the different layers in sequence that is cut by the scalpel. So we start with the skin. In skin, obviously, it is dermis, it is epidermis and dermis. Then comes superficial fascia. And deep to it comes the deep fascia, and then comes the muscle. Okay, so do remember it, skin, which includes epidermis, dermis. Then there's superficial fascia, which normally has a bit of yellowish color fat, subcutaneous layer. And then we have a tough deep fascia, which is actually covering the muscles if they are over there. Muscles are being covered by the deep fascia. Remember the sequence. These are dermatomes. I just leave you the image, but yeah, do remember that dermatomes are very, very important clinically. That we have seen in the when we were discussing the brachial plexus, and also that can also be as a part of clinical applied. So our entire body has the 31 pair of spinal nerves, and all these 31 pair of spinal nerves except the C1 nerve, which has no sensory distribution. C1 has no sensory distribution, and apart from this, all the others, they more or less they contribute to the dermatomes. They go and supply the different areas of the skin sensory distribution. So whenever we pain, touch, temperature, vibration, proprioception, all those sensory receptors which you study in physiology in detail, the nerve values are over here. Okay, so start with cervical, then thoracic, then lumbar, then sacral, and a bit of coccyx in the end. So yeah, dermatomes are also you should actually have an image of it in your room. Okay, pasted of it so that it will come a lot in your entire MBBS journey. Okay, that a patient had a problem over here, so which dermatome, so you should know it, right? You should take a have a printout of it and paste it on one of the walls or whatever way you study. Okay, then you have this retinacula and the tendons over here. So what is retinacula? Retinacula is nothing but it is a modification of deep fascia. So that can also come as a question. That what is the retinacula? It's just a modification of deep fascia. It's a deep fascia modification. Okay, what is this deep fascia modification doing over here? These modifications, they help to keep the tendon in place. For example, you can see over here. Here, what is being shown in the image is the carpal bones, which are over here. And then you must have seen the bow and arrow, no? This is the bow, and there's the bowstring over here, right? The bowstring. So what happens is the more you tighten this string over here, the more you tighten the string over here. Suppose you tighten it more, this bow becomes a bit more bent like this. Yes or no? If you tighten the string more. So in our body also, this string is the role of the string is being done by the retinacula over here. And what this body of the bow over here, the body of the bow over here is the carpal bones over here. Okay, just an example. So more you tighten the retinacula, there will be more space, and this space is being filled by the tendons, which is passed through from the forearm to the hand, or forearm to the palm. This happens both the sides, not just palm, but in even the dorsal side. Same happens in the lower limb also. So that's very important for the retinacula. So do remember, it's a modification deep fascia that can come. Here's an image of it, and demonstrating the function of retinacula. It's quite an old image, but yeah, here try to focus on this part. Try to focus on this part. How they are tightening, how they are showing the relevance of this retinacula over here. This is a retinacula over here. In this side, there is no retinacula. And see what will happen to the tendons. This rope over here is actually the tendons. If there's no retinacula, over here, see the tendons will start to pop out from the joints. Okay, it will be very uncomfortable to see and feel, and just imagine their functioning will be lost. And if there is this circle over here, this is the retinacula over here. And see, in this case, the tendon over here is doing this function absolutely perfect. Okay, this is the role of the retinaculus. Okay, let's move forward to the bones over here. A question can come from bones, not entirely, but yeah. In bones, normally the questions which do come from the skeleton is one question that is very, very, very favorite of the examiners is the blood supply of the bones. The blood supply of the bones. So if you know the parts of the bones, whatever parts you know about the bones all have a separate name for the artery, like epiphyseal artery, metaphyseal artery, and nutrient artery, periosteal artery. So what are their parts of the bones? Each one of them has their own individual arteries to supply them, because bone is a very, very vascular structure. Inside the bones, you have the bone marrow, and the blood cells are being produced over here in the bone marrow. Understand this. Bone is a highly vascular structure. So you need a lot of blood vessels supplying the bones. Okay, so do remember that can come as a question. These are different types of bones over there. Like short bones, we have the tarsals and carpals. They can come as a short bones. Names are very simple. You have flat bones, like one question we did about the sternum. We'll do some more MCQs after this. Irregular bones like this. Which bone is this? Just imagine it's a bone of the skull. It's one of the inner bones known as a sphenoid bone over here. Then we have pneumatic. Pneumatic means when there air inside it. The bones are very light, like the bones of the birds. Bones of the birds, they are pneumatic bones. They're very light bones. They can easily fly. Here in our human body is a facial bones which are having the air spaces inside them. Facial bones, not the skull, but the facial bones over here. Yeah. Then you have the laws of ossification, that the end which appears first, it fuses last, the exception being the fibula over here. So this is all the theory part of the anatomy that can come as a question. So, and the important part will be the law of ossification. Law of ossification, that is frequently asked, come as a short question also, maybe a 2 or 3 marks question. Law of ossification. So this epiphysis, you have to draw some bones over there: epiphysis, metaphysis, diphysis. And there's some primary center ossification. These are the secondary center of ossifications. These are secondary center ossification. When two ends, because long bone has two ends, so two ends will have different time appearance of the secondary center of ossification. So the center which appears first, it appears like it will be fused. It will be fused with the diphysis also first. That is not the law. The law is the secondary center which appears first, it fuses last. That is the law. The exception is this bone which is being shown over here. That is the fibula bone. Here you can see that this lower end which is appearing in first year. So by the law, this lower end which is appearing in first year, the secondary center appearing in first year, and the upper end whose secondary center appearing in third and fourth year. So by the law, this lower end should fuse with the diaphysis in the last or later. But here, the first year secondary center which appears first, it fuses first. Okay, and you can see this is fusing at 15th, 17th year. And the upper end epiphysis is fusing in 17, 19. That's the only exception that you should know. But a law of ossification also it comes. And there's milking cow position. Here the direction of the nutrient foramens. So you should know this also. And it's not very difficult to make the milking cow. You don't have to make the entire face and all. Even if you make this upper limb going like this and the hand over here, and you can make this knee and the foot over here, and then roughly can make a face or a rounded face and a body over here. This serves your point. Only point is your arrows should be clear. So to the elbow I go, from the knee I flee, right? There's a mnemonic over here. To the elbow I go, from the knee I flee, the direction of the nutrient foramens. It is opposite to the growing end of the bones. Okay, so milking cow position, that is also frequently asked. You should know this. And again, this vessels, which I was trying to tell you that okay, there are a lot of vessels. You have the secondary center ossification, and you can see this nutrient artery going over here. Likewise, you have epiphyseal arteries, you have metaphyseal arteries, you have periosteal arteries, and all that. So yeah, blood vessels also a very important question which can come in your theory exam. Okay, let us do some MCQs over here from where we left. Okay, let us try to do some MCQs over here. And here we go. Okay, so I guess as we have done, flat bone was which one? It was the sternum, that was a flat bone. Okay, what is the humerus bone? It is a long bone. Hamate, it is a short bone. Okay, carpal. What is maxillofacial bone? Pneumatic bone. It will be a pneumatic bone. Okay, let us see more. Okay, a very interesting question. A 26-year-old man suffers from a fractured tibia. Tibia is one of the leg bones. Which of the following structure would likely produce the acute pain from the fracture? Obviously, then when there's any fracture, a lot of pain. They're just asking that the pain that is coming from a fracture is coming from which nerve? Is it the nerve in the compact bone? Is it the nerve in the trabecular or the cancellous bone? Is it the surrounding muscles, or is it the nerve in the periosteum? What is that main involved nerve which is causing the pain? Answer is nerves in the periosteum. They're covering the bones. Because by definition, when you will learn about ortho also, a fracture means that there is a disruption in the continuous lining of the periosteum. That is known as fracture. Periosteum is nothing but that fibrous tissue that is covering the bone. So when this disruption in the continuous lining of periosteum, that is by definition it is fracture. And the nerves from there, They are the ones that will cause pain in your fracture. So do remember that also. Okay. Next question. Which of the following parts of bone ossifies from the primary ossification center? So as we were discussing, know that there's a long bone and there are the two ends. The ends are coming from secondary center of ossification. The primary center of ossification is somewhere over here, right in the middle of the bone, and that refers to the diaphysis over here. Okay, that comes the question. Now, all these questions I'm telling you, they will not only help you in this university exam, but also in your NEET PGA and all the next NICT. So remember the basics over here. Epiphysis comes from the secondary center, and where it fuses with the diaphysis, there you have the epiphyseal plate, and the metaphysis is the region between the epiphysis and diaphysis. Okay, so do remember this basic part. Okay, now come to the joints. Let us do a couple of questions on joints, then we'll see the topic over here as well. Okay, let's start with it. Which of the following is an example of a cartilaginous joint? Now, joints is a must-know topic from the general anatomy. We'll do this in the whole classification a bit detail. It'll take around 5-10 minutes, but this will do in a bit detail. But joints is one of the most important, or not the one of, but is the most important topic from the general anatomy. Question: which of the following is an example of cartilaginous joint? Humeroulnar, middle radioulnar, intervertebral disc, or the cranial suture joint? Answer over here, let me tell you, or let me not tell you the answer over here. We'll figure it out. Okay, so let us study the joints for a few minutes. Joints, basically, we know the definition. There are two or more than two bones that meet, that is joint. Joint is basically of three varieties. Very, very important, guys. If you are with me, then you should be answering also ahead in your minds. One is the fibrous joint. One is the cartilaginous joint, as the question was there. And the most numerous joints are the synovial joints. Okay, these are three variety of joints that we know about. Names. Now, how to remember the names, sir? Whenever there's a fibrous tissue between two bones, it is fibrous joint. For example, over here, we have the sutures of the skull. Here the bones don't move, no, because there's sutural ligament between the bones, sutures. Then your teeth and socket, the gomphosis over here. Right? The teeth also, they are not moving from the socket, fibrous joint. Then there's also what we call it as a between the, say, the two forearm bones, the radius ulna, we have the interosseous membrane. By nature, it is also a fibrous tissue. Okay, but there's some movement, but that movement is not through the interosseous membrane. That movement is through the radioulnar joint, superior and inferior. So that space over there, that is known as your syndesmosis, where you have fibrous tissue. Example I told as an interosseous membrane. That is a fibrous joint. Then there's cartilaginous. What's the cartilaginous? When there is cartilage between the bones. When there is cartilage between the bones, we call it as cartilaginous. If the space is entirely covered by hyaline cartilage, we will call it as a primary cartilaginous. We'll call it as what? We'll call it as primary cartilaginous. Okay. And when there is, along with hyaline cartilage, I'll show you image also, don't worry. There's also a bit of your white fibrocartilage. Okay, so the mixture of cartilages between the bones. What is cartilage? So it is cartilaginous, but here we call it as secondary cartilaginous. Understand the concept. Okay, if you understood the concept, the things become very clear. It is like, you know, the ground floor of the house, the neve, the basement of your building. If that is solid, and you can make 4, 5, 10, 15, 20 floors. Okay, so primary cartilaginous is when you have only hyaline cartilage. Now, we have seen example of it. Like we have the epiphysis of the bone, developing bone. We have the diaphysis of the developing bone, and we have another epiphysis of the developing bone. Now, in between this, in between this epiphysis and diaphysis, here this is area as a growth plate, and it is the cartilage over here. So if you do an X-ray of a small child, you will see three different bones for one bone. And in between the epiphysis diaphysis, it's an empty space because cartilages are radiolucent. They are not radiopaque. So this part is cartilage. And you have a bone over it, bone over here. So which type of joint it is? It is primary cartilage. So this is a primary cartilaginous. So it is a growth plate over here that is primary cartilage. It is also known as synchondrosis. Synchondrosis. It is between epiphysis and diaphysis. We can also call it as epiphyseal-diphyseal joint. Yes or no? Epiphyseal-diphyseal joint. And tell me, once the secondary center fuses with the primary center of ossification, will the cartilage remain like this? Obviously not. Therefore, this particular type of joint, it is a temporary joint. It is, try to understand, it's a temporary joint. Now, these all can be beautiful questions. Which of the following example of joint is a temporary joint? It is synchondrosis, which is normally a temporary joint or a primary cartilaginous, because that cartilage is not going to be there. At some places it might be, but in a normal long bone, in an epiphyseal joint, it's a temporary joint. Because after some time, there's going to be ossification, and this entire space will be filled by the osteoid tissue, and the blood vessels will come over here, and that cartilage will be replaced by the bony tissue. Got the point about the primary cartilaginous? Then we have secondary cartilaginous joint over here. And here do remember that they are mostly in the midline of the body. Mostly in the midline, and they have slight movement. Yes, now the movement is beginning to come. There's slight movement over here. This fibrous joint and the primary cartilaginous, they both were immobile. They both were immobile joints. The slight movement starts over here. For some examples, midline, like intervertebral disc. Intervertebral disc. Between the vertebral body, we have an intervertebral disc. That is your secondary cartilaginous. They are also remembered by the name symphysis. So you have pubic symphysis, mental symphysis, all the symphysis. So those symphysis come as a secondary cartilaginous. So do remember over this is a very, very important part of the entire general anatomy. Do remember the word symphysis is secondary cartilaginous. Do remember the word synchondrosis, it's primary cartilaginous. And do understand what is fibrous. Last but not the least comes a synovial joint. Here we have these are mobile joints. The most of the body, most of the movements which you are doing, like even I'm talking right now, my lower jaw is moving. So there's a joint over here, temporomandibular joint. You can feel whenever we move our mandible, when we speak, there's some movement over here. When I'm moving my hand, there's a movement. These are all synovial joint. What's the peculiarity? Synovial joints, what happens is you have a bone over here, you have a bone over here. Here, this part of the bone is covered by cartilage. So here you have like cushioning of what? Cartilage. Point number one. Then you have a synovial membrane also, and this membrane secretes a fluid, a greasy fluid, and that will be known as synovial fluid. So this will be synovial fluid over here, a very thin layer, but that fluid might leak out, yes or no? So just so that the fluid does not leak out, because there's too much of movement also, it is covered by a capsule also. And just to support the capsule, there are various ligaments that will come and anchor the capsule. That is a typical picture of a synovial joint. You have synovial membrane, you have synovial fluid, you have a capsule, and then there's a lot of movement between the bones. That is synovial joint. Now, how to classify synovial joints? Okay, that also we can see. Very rapid classification over here. Just in a couple of minutes, I'll do with the classification. Here we can classify it by the basis of the movements. In how many axes the movement is occurring. For example, the movement is not occurring in any axis. This only gliding. That is known as plane type of joint. Which joint? Plane type of joint. For example, simply gliding against each other. Second, movement is around only one axis. Only one axis. So there's one axis and the movement is around that axis only. Like the hinges of the door. The door can be only open and close in this way. If the door is made in this manner, you can just go up and down or go rotate the door. It will open and close in that manner only. So that is uniaxial. And the examples over here are pivot joint. And the example I was telling for the door, the hinge joint. You'll see the examples. Then there is biaxial, movement in more than one axis. Movement in more than one axis. Like fingers, like a flexion extension, and they are slightly expand also. So examples comes like condyloid joint, where you have the condyles over here. Okay, ellipsoid variety. So these all come under biaxial. Movement more than one axis. Then there is multi-axial, like movement in nearly all the axes. You have seen that circumduction movement, no? Ball and socket. So here your answer will be ball and socket variety. And your one more example is saddle variety. This we have written the names, so let me give you at least one example of all of this. That will be more interesting. No? We'll see the images. Don't worry. I'm just giving you theory part over in the next minute. We will do the images. Non-axial plane, like for example, I can give you an example like intercarpal joint. I'm writing IC joint, intercarpal between the carpals. Pivot joint like radioulnar joint. This rotation movement. Axis is the straight axis. Radioulnar joint. Hinge joint. Hinge joint is elbow, knee, ankle. All those are hinge joints. Condyloid, metacarpophalangeal. This is condyloid. Okay. Ellipsoid like your wrist joint. Wrist also you can flex, extend, you can slide, adduct, abduct also. Wrist joint. Ball and socket, shoulder joint. We all know about shoulder joint. Saddle variety, again multiple axes. Like first carpo-metacarpal joint. So you have first carpo-metacarpal joint. Even your sternoclavicular joint, they come under saddle variety. Multiple axis movement. Okay. Basic classification is this. This you should know. Now let us do some images of it, and then we'll again come back to the MCQs and we'll do with the MCQs as well. Okay. Let us go through the images of these joints so that we are well versed with it. Just a second, and here we go. Okay, these are the image just for you understand. This is the fibrous variety shown as a fibrous tissue. This is the PC primary cartilaginous. You are seeing a entire hyaline cartilage, and here you also see fibrocartilage that is secondary cartilaginous. Even they can give you an image and they can ask you out of this which is synchondrosis. Okay, so primary cartilaginous, this is synchondrosis. This one is symphysis. Yes or no? Question can be made in many ways. Basics are clear, concepts are clear, your revision is good, and then only interest will come, and then you are good to go. The images over here. For example, see over here, radius and ulna are shown. This is interosseous membrane syndesmosis. Which variety? F for fibrous. Here you're seeing a hip bone, so the sacroiliac joint. You'll see the lower limb, and then you have a bit of synovial and syndesmosis over here. In the lower joint, you'll see this is teeth and socket gomphosis. Which variety? F for fibrous. Okay. Then this is a special type of suture over here, shindylosis. Just special type of suture for basically MCQs that can come. It is between the two bones. This is the vomer and the sphenoid. So this is the vomer bone over here. In the head neck, you will read. But don't worry, at least have some idea. This is a sphenoid bone. So they fit like a ridge and groove. That has given a special name, is shindylosis. It is type of suture only. Don't worry which type it comes. It is a fibrous suture. A different interesting name has come once in your PG exams as well. Then with this thorax, this I guess if you go to a class on the wall of thorax, we discuss the joints over there. So in a rib cage, sternum, vertebrae, there are so many joints. Most of them are synovial because the lungs expand with each inspiration. You need expansion. Which are not synovial are you must be knowing. You should be knowing it. That is the question. So to begin with, this is the in secondary cartilaginous intervertebral disc that we just discussed. Symphysis, midline joints. This is primary cartilaginous over here. It is which joint between the cartilage and the bone. So we call it as costochondral joint. Costochondral joint, right? This secondary cartilaginous, which joint is this? It is manubrium, and this is the body of sternum. So it is manubriosternal joint. This is manubriosternal joint. Same between the first rib and the sternum. This is the known as what? First chondrosternal joint. You guys remember, it is another very important question. It is which type of joint? First, chondrosternal joint. It is also type of primary cartilaginous only, or even fibrous, but yeah, primary cartilaginous. Why? Because they are not mobile. You should remember this. Again, I'm repeating this because that's an important point you should not miss. That immobile joints which don't move are basically fibrous or primary cartilaginous. Slightly mobile. Okay, immobile also known as what? Is also known as synarthrosis. One more terminology. Synarthrosis. Okay, then slightly mobile, slightly mobile. It is your what? It is normally your secondary cartilaginous. So it is known as amphiarthrosis. Remember amphibians, both in land and water. It is amphiarthrosis. And fully mobile, we all know it is synovial. It is which arthrosis? Diarthrosis, meaning two separate. They can easily move. They are not dependent on each other. They are not fixed to each other. It is diarthrosis. Remember? So remember these terminologies as well. Synarthrosis means fused, immobile. MV means slightly mobile. And di means okay, independent, easily move. Let's see more joints. Synovial joint. Here's the shoulder joint that is being shown. Some joints over here, acromioclavicular. So it is acromion of the scapula. Clavicle over here. Which type of joint? Plain variety. Sternoclavicular joint, which type of joint? We just did an example, saddle variety. So you know that sternoclavicular is a multi-axial. Plane is non-axial. Terminology should be clear. Let's see more. Okay, atlas axis. Rotation like this. So it is this dense of the axis. What is atlas? It is first cervical vertebrae. Axis is atlas is first, axis is second. So this part of the axis which is protruding above, it is known as dense or odontoid process. What happens? It fits over here. It fits over here, and with the help of it, we can move like this. This which movement? Rotation movement, pivot movement, pivot joint. Okay. And the pivot, supination, pronation, again rotation. Here you can see this is which bone. If I ask you, you can pause and answer in your head. This you can see the head of the bone over here. That is the radius. This is radius. This is ulna. This is humerus. And this joint over here is superior radioulnar joint. Superior RU joint. Again, pivot variety. If I ask you pivot falls under which axial? Non-axial, uni, biaxial, or multi? Answer is it is uniaxial. Movement in one axis only. Let us see more examples. You can see the hinge joints over here. Hinge joint is not this one. No, this is the condyloid. Right? Hinges between the phalanges. So here in the phalanges, only one movement can occur, flexion extension. This becomes a hinge joint. This is known as interphalangeal joint. Interphalangeal joint. Hinge joint. Which variety? Uniaxial. Keep on practicing. Look at your own body, look at the joints, and think about okay, which variety of joint it is. Make it like an enjoyable exercise. Play with your friends. Okay. This is the MCP joint, metacarpophalangeal. So this is your condyloid variety, sort of biaxial. Here you will have the wrist joint, ellipsoid variety. This is the first CMC, first carpometacarpal. Why first? Because this is a thumb over here. This was which variety? First CMC, saddle variety, multi-axial. Thumb can move in so many directions. Flexion, extension, adduction, abduction, opposition, reposition. So saddle variety. First CMC is first carpo, metacarpal. These are the metacarpals. These are all the first, second, third, fourth, fifth metacarpals. So the question can come like an image and an arrow and simply asking you. Very good questions. Again, metacarpophalangeal we did ball. This is a foot because not going in detail, but yeah, once you reach the lower limb, we'll discuss this. You have a ball and socket between the bones talus and navicular over here, and saddle is between the bones calcaneum and cuboid over here. So remember this. This is a type of joint over here. But inside our tarsals also, we have the joints which are moving in so many directions. Why? Because we are walking. Normally in human evolution, we have walked barefoot. It is just the last 100, 200 years, we can say, 200, 300 max to max, that the footways have come into play. Before that, it was barefoot. Lakhs and lakhs of years, it was barefoot. You can see that, understand the type of joints in the foot, right? Here again, the thumb part is shown, the other bones are shown. There's a hip bone, so you know that this is a which joint? It's always ball and socket, the hip joint, ball and socket. Okay, so do remember this. And let's come to the MCQs now. Joints classification we have done. And let us see that how many questions we can try to answer over here. There will be more questions and we'll try to answer as much as possible. Just a second. Right over here. Okay, so guys, do remember that these are all the things that we need to cover up. Yeah, I think this we have done. Yes, this also we have done the flat bone. This also we have done. Yes. Which of the following part of the bones ossifies on the primary center? I guess we have done diaphysis. Was the answer of it? Okay. Which of the following example of here comes the joints part. Example of cartilaginous. Cartilaginous, remember, they are not specifying it is primary or secondary. Primary we have epiphyseal, diphyseal. Secondary are mostly in the midline. And here is the intervertebral disc. It is secondary cartilaginous. If you look at the other options, Humeral ulnar comes under elbow, so it is your type of hinge variety. Middle radial ulnar is a fibrous syndesmosis. Can you switch it again a fibrous? Let us see more. So here the question comes like match the uh, correct pair of joints with their examples. Let us see what are the various type of joints, their examples. The hinge joint over here. Yes, which is the hinge joint? Shoulder is carpal metacarpal. There is no hinge joint over here. Condyloid variety. Condyloid is which one? Metacarpal hinges. 2A. 2A is correct. I guess we have more options over here. Yes, here we have. So 2A will be correct. Okay. 1E goes because one is none of them was a hinge, so none of the above. Ball and socket, we have the 3B is over here. Saddle variety is what? Carpal metacarpal joint. Yes, so 4D will be there. Now let us see. 1 E, A, B, and D over here. Yes, yeah, option number C. Okay, likewise over here. Which of the following joint permits multi-axial movement? Pivot, uniaxial, ball and socket, multi-axial, condyloid, biaxial, hinge, uniaxial. Answer is ball and socket and saddle variety. So in addition to it, this for the revision, saddle variety. Okay, appropriate class inferior tibial fibula. Inferior tibial fibula joint is a separate joint. We'll do in the lower limb, but yeah, that comes under the fibrous variety. Okay, inferior tibial fibula is one of the exceptions over here. Okay, so these are some of the questions that we did. Again, coming to back, guys. So in general anatomy, if we just revise what needs to be done in general anatomy, basically to begin with, you can't play with anatomical position and planes. What is medial, lateral? This is a must know. This is like ABCD of English. Literally, for an entire MBBS, this is the ABCD. If you don't know the ABCD, then obviously things are going to be not difficult. They are going to be impossible. So this is the ABCD. Then we come to you should know the bones and joints. This is must know. And after doing this, then you can go with topics related to muscle, nervous tissue, cardiovascular system. Yeah, they will come into picture. But yeah, these are the most important parts. Position planes, bones, joints, and their typical examples. That comes the question. Again, revising back, I gave you in the beginning what are the tips to write the exam. Just to revise, guys, time management is must. Is must. Then what are the first questions that you need to answer? Try to write in sequence, diagrams, okay, neat and tidy. That all we have discussed initially. I'm not going to discuss it again, but yeah, these things you must know. So guys, this was our general anatomy today. Tomorrow we'll come back same time, and tomorrow we'll be dealing with or starting with the embryology part. Embryology part will be happening tomorrow, same time, 8 to 9 p.m. Okay. So that's all from my side, guys. Let us see if, yeah, what's our subscription. You can take the screenshot of this. This will help you if you take the screenshot of this to understand. Okay, that and also the code that you can apply below, the code that you can apply so that you can get some discount. So the good part is we have from 3 months to 4 years plan. 6 months, 12 months. So you can see from 12 months, you have this hard copy notes and one-to-one doubt clearing session. That is what is this doubt clearing session? Some of you might be thinking, what is this? Do we really need doubt clearing session? What is the doubt clearing session? Because yeah, people become spectacle like, what is doubt? I mean, see, doubt clearing session, nothing. We are doing a professional course. It is like a mentorship program. And your mentors over here are very, very experienced who have seen the ups and downs of this whole medical career. Okay, the past so many years. So I guess that is invaluable sort of stuff. The doubt clearing sessions, one-to-one doubt clearing sessions. So yes, think about it. Hard copy notes, one of the my personal favorite, the way they have written. And yes, you can apply the code also, Dr Ankit 20 in the bottom line you can see, and you can get some discounts over here. So guys, that was just the beginning to begin in general anatomy and trying to solve some of the questions. If you even look at some of the questions over here, when we begin anatomical terminology, okay, long essay, for example, over here. Okay, then you have the joints, which again, and then sagittal coronal section. Okay, then you have skeletal system. What is axial appendicular skeleton? That you should know. The middle skeleton is axial skeleton, axis. The appendage is upper and lower limb bones. They are appendicular skeleton. Okay, anatomic positions, synovial and synovial joints over here. So understand this. Very important, guys. No topic is less important or more important. Actually, it is. Yeah, I have to cover up maximum parts. But yeah, I told you a couple of points, couple of topics which are more important over here compared to others. That's all from my side. Thank you for your time, and I hope you enjoyed as well. Bye bye and take care. Thank you.